Good afternoon, everybody. Thanks for joining us at our weekly COVID-19 briefing. Note that live captioning is available and a recording of today's session will be posted later today. Today we'll be able to go until 2 p.m., so we'll have plenty of time for questions that either came in advance or hopefully some that come to us during this session as well. I'd like to introduce again this week's participants. Of course, we're joined as always by Provost Susan Collins, Vice President of Student Life, Martino Harmon, our Campus Chief Health Officer, Dr. Preeti Malani, and each of them will give brief updates in a couple of minutes. Dr. Malani will summarize our options for COVID-19 testing as well. We're joined today by Dean of the College, Laura Blake Jones, who will discuss updates to our student-focused information campaign and issues of safety and engagement for students around our upcoming football season, which begins a week from tomorrow. We've gathered questions that have come in from the community during the week, so we'll be able to answer some of those as well as new ones that come in during the talk, as I mentioned a moment ago. So let me first turn things over to Dr. Malani to give us an update on campus conditions. Preeti?
Yeah, thanks, Mark. And unfortunately, I don't have good news to share today. This week has been exceptionally busy on campus because things have moved in the wrong direction in terms of COVID. And this is something that from last week to this week, there was a movement in the wrong direction. As I reported last week, things were looking pretty good, but unfortunately, several cases were identified late Friday and over the weekend, primarily in residence halls, but also in some off-campus residents. And in this case, pop-up targeting testing that was done at the affected residence halls identified several additional asymptomatic cases. And again, some of this has been shared on the COVID dashboard, but like prior clusters, these cases were related to social gatherings. And unfortunately, some of the individuals who tested positive also had large numbers of close contacts. So many students had to be moved to quarantine housing because of these high-risk exposures. And as a result, the residents of specific floors in a couple of the halls, and most notably Markley Hall, have been asked to maintain enhanced social distancing for 14 days. And these recommendations have been made in partnership with the Washtenaw County Health Department. And I just want to note the wonderful relationship that we've had really since January with Juan Marquez and Laura Bauman at the County Health Department, others as well. We've had a long-standing relationship, but we've worked really every day with them since then. And they've been very helpful in trying to help us manage the situation, particularly at Markley, to make sure that things don't continue to increase and that we can prevent this from growing in terms of an outbreak. I will note that we're waiting on some additional pop-up testing results that should be back later today. The campus health response team, and these are the people who are doing the very difficult work of trying to maintain some type of safe residential experience for our students, are extremely concerned. The number of people that are requiring transfer out of the residence halls to either quarantine or isolation housing is not sustainable. And this is partly why there's a recommendation for people to sort of stay put. And again, the folks that have been identified as either infected or close contacts have been removed from that location. So I am optimistic that things can be turned around and that there is some encouraging news from both pop-up testing and surveillance testing at other halls. And it may be that Markley is a little bit of an outlier. There haven't been very many asymptomatic cases in these other settings. But turning things around is going to require effort. So for now, it's more of the same. It's what we keep hearing, but wearing your masks, watching your distance, monitoring your health, and most importantly, really keeping social interactions limited to very small groups and to safe settings. Only with everyone doing these things can we really continue to be together safely. We are starting to think about November and working on a testing plan for students before they leave Ann Arbor. So students, you'll expect an email survey in the coming weeks, coming actually soon, to start this process. And we really want to understand what people's plans are in terms of leaving campus housing, understanding that this might be fluid for some people, but this information will help inform the planning process. Now, this type of departure testing is meant to reduce the risk of students who are potentially infected with COVID-19 as they return to their home communities. But testing, and I say this every week, it's only part of a safe return plan. Negative testing doesn't mean you aren't contagious. And in fact, I want to remind everyone, we all have to act as if we are contagious, and others around us need to do this as well. And again, this gets highlighted. Negative tests don't mean that you're safe. In the meantime, the community sampling and tracking program is continuing to ramp up. It's available for anyone on the Ann Arbor campus, students, faculty, and staff, including Michigan Medicine. This is asymptomatic testing. If you haven't done so, please sign up. The testing team is actually starting a rotating on-site testing opportunity for students living in residence halls. So this week they were at Bursley. And again, I mentioned that this is going to ramp up to about 6,000 tests a week. I think they're going to Cousins next. All of this is a reminder that we are still in the midst of a global pandemic. It is not business as usual. We are more than 8 months since we dispersed in March, and we continue to be faced with hard choices. I just say that this entire situation is awful. It's awful for different reasons for different members of our community, but unfortunately there's not an end in sight, and things are likely to be like this next semester and perhaps longer. For especially our first year students, you deserved a better end to your senior year, and you deserve to have a normal college experience. But what we promised you was a semester that was not going to be normal. I wish you could pile up in a room and have a birthday party and do the things that you should be doing as young adults. But the only way we can manage risk is to continue to be in residence is by all working together and making good decisions to protect yourself and those around you. And I will say that by and large, everyone is making good decisions. But shared risk, it means shared responsibility, and high risk behavior when it does occur. And in this case, it's social gatherings, indoors and outdoors. You can really put the whole community at risk. So I think it would be very difficult to continue on in residence if things continue moving in the wrong direction. But again, I just want to thank everyone, the students, parents, faculty, staff, really for everyone trying to do the right thing. It's hard, it's exhausting. I continue to believe that there's a middle ground where we can find ways to interact safely. My last comment is just a reminder to everyone to get their flu shot, and a reminder to students, this was part of your health fee, so you can go and get your shot. No additional costs, no need for insurance cards. And I just looked on the UHS site, and there are plenty of openings for Monday, the 19th. Thanks.
Thanks very much, Preeti. I'll now hand things over to Provost Collins for an update.
Great, thank you very much. I'm going to use most of my time today to talk about some of the outreach that we are doing to gather information for our winter 2021 semester, which is coming up pretty quickly, even though we have many weeks to go. So I'll also very briefly talk about some of the exciting programming around our democracy and debate theme semester and how it relates to the upcoming election. But I wanted to start again today by just acknowledging how challenging the current context is for so many members of our university community. As the semester progresses, there's just an increasing toll on all of us. The uncertainties, so many aspects of daily life, from work to our own health, the health of our loved ones, and those of course are compounded by, in particular, child and dependent care responsibilities and K-12 virtual schooling. That's a lot. In particular to our junior faculty, we do understand that there are consequences in terms of research productivity, and these are issues that we will be talking more about going forward. I'd like to encourage all of our faculty, students, and staff to find time for self-care in this context. For example, mHealthy online, their live stream exercises, try out the Carol On concerts at Burton Memorial Hall. I've really enjoyed those as well. Our UMS and the School of Music, Theater, and Dance have so many things to be live streamed. And so again, really encourage you to do that. And want to remind you about the university excellent resources in CAPS, SPASCO, Michigan Medicine's Office of Counseling and Workplace Resilience. So as I mentioned at the outset, we are deeply engaged in our planning efforts for winter 2021. And input from the community is extremely important for these efforts. I just want to share some of the things that we're doing. First of all, to all of our enrolled students on the Ann Arbor campus, you will receive a survey today. And essentially, before we make our final decisions, for the next semester, your experiences during the fall and your responses will really help us to understand specifically what things went well and what things didn't go so well, and how we can best address them to really deliver the educational mission of the university next semester. The survey is conducted by the Office of Student Life, Assessment and Research. Provost's office worked to develop the questions. The responses are totally confidential, no way that they can be connected with any individual student. And I really ask you to look out for the survey, and please take the time to respond to it. It's not very long, and your input will be really valuable. Turning next to our instructors, in collaboration with SACUA, the Provost's office will be rolling out actually a series of data gathering activities over the coming weeks. The goal is to get information from all instructors, that includes faculty and GSIs on the Ann Arbor campus, about what their experiences have been, both challenges, but also opportunities and things that we can draw from and learn from. So the first very brief survey will launch Monday morning, October 19th. And we'll ask all of you to tell us both about your experiences, but also your preferences for teaching next semester. We also want to find out more about what kind of resources will be most helpful and to enhance your teaching, but also address some of the stress. And we want to know about some of the service and other work-life balance challenges that you've been grappling with. So again, we'll ask every instructor if you would please take the time to respond to what will be a brief survey. You should expect to receive that on Monday. Our staff are really the backbone of our teaching enterprise. Without that staff activity in student service roles, helping prep our labs, our studios with IT, and so much more, we couldn't carry on our educational mission. We're also gathering staff input, starting with some targeted outreach in a variety of student-facing roles in academic units, and then we have a number of more expansive measures that we'll be using going forward. So one very exciting set of things that is underway this fall is the Democracy Debate Theme Semester. So initially a portfolio of in-person activities, the planning team has really done a fabulous job pivoting to an extensive suite of virtual activities for students, faculty, and staff, including around the election. And I'd really like to encourage you to join and participate. Some of the signature events, and I'll just mention one, recently announced is a conversation with Trevor Noah on next week, Tuesday. And please, you have to register for that, so I encourage you to do so. But I also wanted to highlight the Democracy Cafe toolkits, which provide in-depth materials to facilitate virtual inclusive group discussions on a host of important but sometimes challenging topics, both about the current election, but also about democracy as a whole. So in the weeks ahead, we'll be hosting a series of events to put the current election in context. Finally, I just have to remind everybody, especially our students, if you haven't already voted, please make a plan to vote. I will mention as well that UMA is hosting an election hub on campus that makes it really convenient. President Flissel sent out a message to campus this morning with a lot more details about that and other things related to the election. So let me just end with a final plea to look out for the student and the faculty surveys, and please complete them and give us your feedback as we finalize our plans for the winter. Thank you.
Thanks, Provost Collins. Next up is Vice President Harmon for an update on student life.
Thank you, President Saliso. So as the weather gets colder and we shift toward being inside more often, we're very concerned about students feeling isolated and lonely. We've had a lot of feedback to that accord. One of these concerns centers around the dining experience. Without the canopies that will go away at the end of this month, the only option for students to eat is really alone in their rooms. So that concerns us. Michigan Dining is in the process of discussing a possible transition to the next phase of our dining program. In light of everything that's happening that Dr. Malani talked about, though, we're being very cautious about this decision. The safety of our student diners and dining staff, which include our student employees, is top priority. Our protocols, which are actually planned this summer, are public health informed and in alignment with current best practices. We know that many campuses have been offering dine-in for several weeks, and we actually held off on that, and we're still evaluating it. But the experience of other campuses is also informing our decision and our approach. We're also meeting with our dining team members, including student employees, to answer remaining questions and ensure that they have the proper PPE, which currently includes masks and face shields. We also want to be sure that we describe our strategic and precautionary protocols to consider any additional refinements before we make a decision of if we decide to offer this option. Our initial plan is to move into a combination of very limited reservation-only spaces, which represents about 22-23% of our total capacity, and that would be part of a dine-in service in addition to continuing the takeout service. Students would have to be very socially distanced, and they'll have a brief time to finish their meals so that we can clean and sanitize each section that students would sit in. I'm confident in our ability with the campus community's assistance to provide this as a safe option if we decide to pursue this. Next week, you'll be able to view details about the potential plan on our dining website. We will also include a schedule for each dining hall and dine-in times. Takeout, of course, will be available, how to make reservations. So we'll be providing that information as well as the protocols that are in place. But we welcome your feedback, again, as we carefully examine this decision, particularly in light of the current situation. Next, I want to briefly touch on student health and wellness. I want to highlight a couple of programs that support students in making good decisions around self-care. First of all, in addition to providing counseling services to students, CAPS, otherwise known as Counseling and Psychological Services, they are providing a new resource and upcoming programs for first-year students. So I would encourage our first-year students to go to the CAPS website and click Go Blue, a new student's guide to surviving and thriving at UM, which offers several mental health and wellness tips. Also, our Wolverine Wellness Program is providing individual and group wellness coaching. Current group offerings include a first-year transition wellness group and a drop-in group, which focuses on taking care of yourselves and others. Next, I want to address off-campus behavior which impacts health and wellness. So you will hear a little bit later from our Dean of Students, Laura Brake Jones, about the refocus of our Culture of Care campaign. But I want to address concerns about safety in the fraternity sorority life community. Chapters that are found have violated safety and health guidelines, and those that hold gatherings which exceed established limits will be held to accountability measures through self-governance, the university, and their national organizations. The Fraternity Sorority Life Office is aware that some groups have disregarded and violated public health guidelines, and safety is critically important. As a result, some IFC chapters have received educational sanctions, 2 are now on probation, and 1 lost university recognition. I want to be clear, though, that many fraternities and sororities are doing a good job honoring public health guidelines, and those that have experienced cases are working closely with our contact tracers, our public health professionals, as well as the county health department to provide the appropriate information. Finally, I want to mention civic engagement and just build on the theme from Provost Collins. I want to remind students that you all play an important role in the 2020 elections. The University of Michigan is launching an outreach newsletter for students to get involved and get engaged with this election. I want to just highlight, as I close, a couple of opportunities. One would be a video prepared through the Ginsburg Center. You can find that at online.michigan.edu. And then obviously we know this is a contentious election, and especially in the context of COVID and everything happening. So some workshops include the Healing Justice Workshop, Self-Care for Activists and Change Makers, and Taking Care of Ourselves and Others, Well-Being and Civic Engagement. Finally, we'll offer a number of other opportunities for in-person and virtual spaces for students to be engaged in the election. I want to encourage everyone to get involved in this election. Your voice counts. Thank you.
Thanks, Martino. I just have a couple of very brief comments. I had a visit yesterday with our team from EH&S, Environmental Health and Safety, to thank them. They're normally responsible for the safety of our physical environment in our workplace, but they've taken on a very large amount of responsibility and are doing a lot of our contact tracing, and they're really absolutely essential to our campus response to the pandemic. Their director, Danielle Sheen, is a longtime staff member and outstanding colleague. They've really stepped up, and we owe them a debt of gratitude. I want to reiterate something Dr. Malani said about getting a flu shot. It'll make you safer by not worrying about distinguishing between flu symptoms and COVID symptoms. We make them available pretty widely. They're available to students for free, as she said. So please take advantage of this, especially this year. And finally, a thank you to the city clerk and the Ginsburg Center and the Stamp School for this voting site at UMA. It is easy to get in and out of really quickly. Almost 3,000 people from our campus community have already registered, and the vast majority of those have already voted. I dropped off my own mail-in ballot. I put it in a box myself, so I'm confident that it's been received. I got an email saying it's received. So please vote. It's a very important decision. No matter who you vote for, don't forget to vote. So let me hand things over now to Dr. Malani again, who will talk a little bit about testing options, virus testing options on campus and where that's heading.
Thank you. And I'm going to read from a new graphic that actually we're going to share the link with everyone. This just went up on the COVID site. It's titled "How to Get a COVID Test at U of M." And I just want to give a shout out. You don't see them in settings like this, but the people behind the scenes, Kelly Michaels and her team, and in particular Dana Elger, who's been walking this with us. She got assigned to help us with COVID back in January, and I don't know if she knew that she would still be with us, into the fall, but she was central to putting together this beautiful flow chart. And basically, I want to point out that there are different options for students and faculty and staff. There are different options if you have symptoms. The students, again, the University Health Service should be your go-to, and there are instructions here. There's a phone number as well as a link to the assessment tool form online. And then faculty and staff who, as well as health sciences students in medical, dental, nursing, and pharmacy, as well as student employees who have symptoms, they can contact the Occupational Health Services hotline and make arrangements. And again, it's important to isolate from others while you're waiting on your test. If you don't have symptoms and want to get tested, this is a little bit of a different bucket. And my recommendation to everyone, again, is to sign up for the Community Sampling and Tracking Program. This is our asymptomatic surveillance program. It's now saliva-based. It's been made much more convenient. We're going to particular residence halls to improve accessibility. And it was previously just at Palmer Commons. It's now up in Pierpont and other settings. So this is, the capacity is up to 6,000 a week. And this is a good way, for folks that don't have symptoms, but they'd like to get tested for whatever reason. If you are a confirmed close contact, you're going to probably fall under our quarantine housing as a student. And there is a protocol to test people. We usually do this 5 or more days afterward, knowing what we know in terms of the incubation period. Obviously, if you have symptoms, you would fall into a little bit different bucket. But this again, this is important if you've had close contact. If you're worried about possible exposure, you fall into a little bit of different a bucket, and again, not a confirmed close contact. This is where either the community sampling and tracking program might be good for you, or depending on where you are and the exposure, the health service can also help you. So again, you can look at this chart. I want to point out that some people are worried about possible exposure either because of where they live or they work. And this too is a good opportunity to enroll in the community sampling and tracking program. I think that this is something that can help reassure people who are concerned about being on campus or living on campus. And again, what we're finding is that the people that are developing COVID infection, by and large, there is a very clear exposure, and it's a social exposure. But this is helpful. It's helpful for us also to learn about where potential risks might be. If you're in quarantine, again, the health service is monitoring those students. There are other buckets, like if you're planning travel or you have a medical procedure, depending on if you're a student, the health service can help you. And if not, it may be your medical provider that will help you with those things. And again, it's a really, really great, it's a great chart. I just want to make one more comment about testing, and it came up again a little bit this week. I know that some students are going off-site to the urgent cares, and you get a rapid result. It's an antigen testing. It has a little bit different quality of test. I would say that sometimes you'll get a positive test, and it might not be positive, and you might get a negative test that might not be negative. The issue is, even though you get that test quickly, you don't get a lot with the test. And twice this week, I heard about a student who got a positive test, didn't know what to do. And it is very stressful to get a test like this. I think especially if you're living in the residence hall and you're thinking, now what's going to happen to me? What's going to happen to my classes? Those test results do eventually feed back to the university through the county health department. But what it does is it delays the ability to give you that support. And I think it can create some difficult situations. So again, although it's convenient, and especially if you're going to get tested just because you're not symptomatic, you're curious, I have pointed out numerous times that getting tested doesn't give you sort of a passport to go to a party without following all the other mitigation measures. And, you know, again, the situation at the White House illustrated that a negative test doesn't mean you don't have risk. So again, I would encourage you to really think about getting tested at the health service. They are set up to do this. They tested about 600 students last week who had symptoms or for other reasons. So they're there, it's student focused, and they can connect you to the other resources you might need.
And one thing I'll amplify, Preeti, about the surveillance program is faculty and staff, even those that are only occasionally on campus, are free to sign up for this program. And you get sent an email telling you you've been selected, and then you can make an appointment at a time that's convenient for you. So you can make the appointment on a time you're going to be on campus anyway, because we'd like not to bring people onto campus just to be tested. So it's really flexible, and it's up to you to determine whether you're on campus frequently enough to merit a test. It's entirely up to you. So please sign up for this program. Make an appointment at your convenience, keep the appointment, and you can be tested as frequently as every week. Okay, so Preeti, you're now going to bring Dean Jones on to discuss trends among students.
Yeah, so it's my pleasure to introduce Laura Blake Jones, who's the Dean of Students. And Laura, thank you for everything you've done. Your office has been, you're always amazing, and you know, you're always dealing with a lot. And this year, I think that work has been doubled and tripled, so thank you. We'd love to hear your comments around the Wolverine culture of care.
Thank you, Dr. Milani, and good afternoon, everyone. I'm pleased to be here with you today to talk about the Wolverine culture of care and to provide an update on our planning efforts for the return of football and Halloween. The Wolverine culture of care was created last summer by a group of student leaders who worked diligently to codify the aspirations that we all have for successfully navigating through this pandemic together as a caring, conscientious, and supportive community. It includes a pledge that we ask community members to take, as well as a set of messages designed to educate the campus community and underscore our commitment to public health best practices to keep our community safe and thriving. The messages have included a wide array of public health reminders, the sharing of our personal motivations during COVID, the What's Your Reasons campaign, and inspiration focused on being mindful of others in our community, taking care of maize and blue. From the beginning, we anticipated the need for this phase 2 update about this time in the fall semester, knowing we would need to refresh our messages, target emerging challenges, and keep everyone's attention. Phase 2 of the Wolverine culture of care includes messaging campaigns that are now focused on stopping the spread and taking care of you and taking care of maize and blue. The practical advice contained in stopping the spread promotes 3 things that we need students to do, and you've heard some reference these already today. First, volunteering for testing by signing up for the community sampling and tracking program. Second, monitoring your health by using the ResponsiBlue daily symptom tracker, whether you are or you aren't coming to campus each day. And third, you can protect our community by opting into the registry as a student to voluntarily share your contact information. Taking care of you and taking care of maize and blue acknowledges the importance of self-care and student well-being at this time in the semester as the weather's changing and academic responsibilities intensify, pointing students to all of the resources and support available for health and well-being and ways to reach out and safely connect with and interact with others. As the weather turns colder and we're looking forward to the return of Michigan football and simultaneously planning for Halloween, I also wanted to provide some updates about this. Our comprehensive planning team that prepares for game days and holidays such as Halloween and St. Patrick's Day has been convened for several weeks now, planning actively for football and Halloween. There's 3 primary areas of emphasis that the group is focused on that include, first and foremost, providing social connections and programs and opportunities for students. Secondly, communicating and reinforcing our public health messaging. And finally, the enforcement of policies and public health orders. We're planning an array of virtual and in-person events to provide opportunities for students to connect with others more and watch the game in a safe manner. The events kick off next week on Monday and extend up through the first away game against Minnesota on the 24th, and our Center for Campus Involvement's countdown to kickoff programming. They are offering photo contests, video contests, spike ball tournaments, mug decorating, a Secrets from Schembechler program, and bike and hike programs on Friday and Saturday before kickoff. During the game, you'll even be able to play game day bingo while you're cheering on our team from wherever you're watching the game. With respect to Halloween, our team is working to address a convergence of challenges. Halloween on a Saturday with an in-state rivalry game being played, a full and blue, no less moon, and the end of daylight savings time during a pandemic. It's a set of circumstances we haven't confronted before, but we're using our strong foundation of research-informed harm reduction strategies to address these challenges head-on and expect that our collaborative work across campus and with our student affairs staff colleagues at Michigan State will be successful in encouraging their students to stay home in East Lansing this year, and that our students will continue to follow recommendations for hosting and attending safe small gatherings in safe settings. Michigan Athletics will also be presenting a Hail from Home digital experience to connect fans to the home games in a variety of ways. It'll include a pregame show, interactive trivia, a game day music playlist, a Go Blue giveaway contest with weekly prizes, and more. If you're interested in that, you can go to their website for complete details. The same students who authored The Wolverine Culture of Care are continuing to use their peer influence to help their fellow students live fully into taking care of you and taking care of Maize and Blue over the holiday weekend. I have to pause and say that their tireless leadership is inspirational. There are a variety of virtual and in-person activities being planned for students to have options to socialize and connect with others, from pumpkin painting to a virtual escape room to Boo Mix late night programming sponsored by CCI. Our students will have a variety of choices for how to spend their Halloween, and to top it off, Michigan Dining will be distributing game day watching food to go from various locations around campus. I want to thank you for the opportunity to provide these brief updates, and most importantly, thank you for your ongoing commitment to practicing self-care and considering the needs of others as we all continue our efforts at taking care of Maize and Blue. Mask up, Michigan, and go Blue.
Thank you, Laura. And I hope that you are also finding ways to take care of yourself. I worry about you, so thank you. I wanted to just shift a bit and ask what trends you're seeing amongst our students, and what your observations have been.
Preeti, the first trend that I would like to highlight, because sometimes what comes to the surface and gets noticed are negative things. But the thing I really want to emphasize, and the trend that I'm seeing, is that most of our students are doing a really, really good job at doing all the right things, all the things we're asking them to do, supporting each other, reminding each other gently when someone is forgetting to wear their mask. They are wearing their masks, they're keeping social distance, they're being thoughtful and thinking about the ramifications of their behaviors on other people. And they're truly, I guess I would say, living the culture of care. And I deeply appreciate that.
Yeah, I appreciate it too. I think there is this narrative out there that somehow, all college students are being irresponsible, and that's certainly not what I've seen either. So thank you. I'm going to shift to a question for Provost Collins. This came in earlier. What accommodations are being made for students who have technical difficulties while submitting exams, and is there a university-wide policy on how to deal with this?
Thank you. That's a really important question, and I'm glad. Thank you to whoever raised it earlier this week. We are actually working on a university-wide guidance that we would share with students to let them know explicitly through a series of steps what to do if the situation arises, and then sharing it out with all of the instructors across the 19 schools and colleges as well. But in particular, with technical difficulties while you're taking or submitting an exam, we would strongly encourage first to contact your instructor so that they're first of all aware of the situation, but also can help work with some of the appropriate teams in order to resolve the problem. Many of our classes, certainly not all, but many of them are using Canvas to administer exams, and anyone who has difficulty through Canvas, in particular related to an exam, but for other reasons as well, is really encouraged to contact ITS, the service center, directly, and they can resolve the issues often pretty quickly. So again, a really important question, especially in midterm season, and then as we know that final exams are coming around the corner as well.
Thanks. And I have another question for you. What should we do when we are in class and our teachers are not following the social distancing guidelines that have been emailed to us by our advisors? For example, requiring us to move around, pass objects around for critique.
So again, another very good question. And the goal really continues to be that for our students, our faculty, and our staff to feel safe and comfortable doing their work when they're on campus. It really should be and should feel no riskier than going to a grocery store when you're coming to campus for classes, for research, for other mission critical work. So more specifically, if a student is concerned about activities in a classroom, I would encourage the first thing to be to raise those concerns directly with the instructor by asking about the safety and public health protocols that are being followed in the class. But if there are questions that remain or a student isn't comfortable doing this, then please contact resources available that are in each unit. That could be your program director, department chair, or the dean's office. And again, an effective way to address those concerns often is local, but at the same time, another option, which is also readily available, is to contact either Academic Human Resources or the university's compliance hotline. And that hotline number, which we have in a variety of different contexts, but it's 866-990-0111.
Thank you. I'm going to actually direct this next question to President Schlissel. Why are students getting sent back to their in-person classes when multiple students receive an email saying someone in their class has COVID, that class being their only in-person class?
Yep, thanks, Preeti. So, we have a notification process that lets students know and lets the faculty know when someone in the class is tested positive. That individual who tested positive has been moved to isolation or quarantine, so they're no longer in the class. The case investigators have spoken to the person who was positive, figuring out who their close contacts were, and if there were individuals in the class that were close contacts, those individuals get contacted by the contact tracers and asked to come in for a test. So the classroom remains safe so long as people wear their masks, keep the appropriate distance, don't form clusters or crowds, don't do things like was pointed out in the question you just answered. So the idea is to notify for the sake of awareness. People with close contacts have been told, students with the positive test have been removed from the class. And that way the class can continue to move forward.
Thank you. Next question is back to Provost Collins. With the holidays approaching, will the university shut down activities, non-essential buildings? and such earlier than the normal late December timeline?
So here again, there are things that are still being finalized, but there's quite a bit I can say at this point on that. Some activities and spaces will remain available to support those who continue to do their work and their scholarship, but that will be more limited. Many of the schools and colleges will have some spaces available. For example, LSA and the College of Engineering, along with the libraries, will continue to have study spaces available for students, but they'll be adjusted because we would anticipate lower demand during those times. Libraries will also provide remote services and circulation. Other university buildings like Michigan Union and Pierpont Commons, along with other facilities that support activities across campus, will operate with a reduced capacity. That will be through the end of the semester. And of course, we'll be announcing some of those specifics. Just a few other things to mention here. The Office of Enrollment Management, which includes the registrar, admissions, financial aid, among other important services, is meeting with their offices in the coming days in order to determine exactly what'll be in person and what'll be fully remote. But for sure, we will continue to meet the needs of campus through a variety of different modalities. So more generally, we'll post all of the details of that information once it's finalized. But again, important questions, and we will continue to meet the needs of those on campus during those time periods.
Thank you. And there was a question regarding how we're handling the increase in number of persons in quarantine and isolation housing. And I can address that, and Martino may have something to add to this, as well as Laura. This is really concerning. Things in the last week in particular, there's been a very robust increase in these numbers, and I know many people are following them on the COVID tracker. I will note that there was a double count error for a couple days, but I think that all got sorted out. And right now, a lot of this is related to quarantine, not even isolation. And it has to do with the fact that there are a lot of contacts, a lot of close contacts. And I mentioned that in my comments. So what are we doing? Well, we're paying attention, and we're actually this was a big topic of discussion this morning at the team that is led by Rob Ernst, who you saw last week. And there still is plenty of housing available, but at the current rate, we will go through it within a couple weeks, especially because numbers of cases increase. They don't sort of stay flat. They increase, as we've all learned. So this is why the order has been put in place on the third floor of Markley, for example, where people aren't leaving. They can leave for certain critical activities and to get fresh air and to get their food, but they're not going to class, for example. And we may have to rethink how long we can continue like this. This is one of the key measures from a public health standpoint that allows us to continue. And again, I would welcome input from the others on this topic.
Yeah, I can mention, we made some really important improvements to the conditions in quarantine and isolation housing several weeks ago. We were originally probably not consistent as we should have been. And so we've really ramped up the communications, the amenities, and really treated the experience almost like a hotel experience where people may not have all the things they need, unlike a residence hall. We have a quarantine and isolation coordination care center on site with staff on site that work closely with the Dean of Student Staff, as well as UHS, in making sure that we're responding to the needs of the students. So we have the systems in place, and we've improved those systems. But clearly, as the number of students increase, that is a significant concern beyond just the quality of the quarantine and isolation experience.
Yeah,
Thank you.
I'll add one thing too, Preeti. Other universities have been through what we're going through right now, where either individual dorms or even more widely than that have large outbreaks, and the dorms get, in effect, put on this modified or enhanced social distancing or a modified quarantine for a period of 2 weeks to see if things calm down, and then people go back to class. So Illinois, that's doing a massive amount of testing, the second week people were on class, they had 1,000 students with COVID-19 positive tests. There was a 2-week period where the entire campus went on this limited quarantine basis. and they are back up and running during the semester with very low levels of positives. Something similar happened at Notre Dame very early in the academic year, where they had to put people on a 2-week period of time where their interactions were very limited. So in our instance, with 1 or 2 dorms showing unacceptable numbers of cases, we'll initially target the interventions to those dorms. But if we can't get ahead of this, that's one of the criteria that may lead us to end the semester early. If we exceed our ability to quarantine students, if we exceed our ability to do case tracking, those are all indications that our efforts have not been fully successful. We've made it through a little bit more than half the semester, but we'd have to recognize the difficulty and then pivot to safely getting students out of the dorms and back home if we can't get ahead of where we are right now.
Yeah, I'm glad that you said it that way, because I have to say that the group of us, and again, this is really Rob Ernst and Emily Martin and Lindsay Mortensen, who are doing the bulk of the really heavy lifting on this. I think we felt a little bit deflated really in the last few days. So we're hoping it turns around, and I do think it will turn around. And I think there's some reason to believe Markley might be a little bit of an outlier because of the information we're getting from the other halls. But I want the community to know that we're paying really close attention to this, and that number is actually a very, very critical number for us, not just number of positives, it's where they're located. So there was a question that after, it's related to quarantine, if you have a negative COVID test after 5 or 7 days of exposure, can you return to work or school rather than waiting the 14 days? So the quick answer to this is no, you can't test your way out of quarantine. There are some different rules at the health system regarding exposures, but again, I think that's particular to the health system. For the standard everyday person, if you have a close exposure that you're required to quarantine, the testing is important. And if you remember, the CDC sort of changed their tune on this for a while. They said, don't test anyone, but clearly it is important to test folks. And we've been doing it around day 5 based on guidance from our public health department, but there's not one magic date. And testing negative is good, it's good news, but it doesn't get you out of quarantine. And in fact, symptoms and positive testing can happen much later in the quarantine. There's another question. What is someone supposed to do if they test positive? UHS takes up to 24 hours to respond. So what is someone supposed to do during that time if they have roommates, live in a dorm? I think this is a real situation that has come up, and often the positives, like I said, are coming from the urgent cares where they'll test you, but there's not really any follow-up. And what I would say is during business hours, if you call the health service and explain the situation, someone will help take care of you quickly. If it's after hours, I would, again, we talked about the COVID hotline. I think that tends to be probably the best way in terms of getting to somebody. Often in the middle of the night, we may not be able to necessarily respond and react as quickly as possible. It is important if you live with roommates. Clearly you've probably been in that situation. It is a stressful time, but the risk probably isn't going to change much. You're going to want to keep a mask on yourself as well as others, but someone can at least give you some advice on next steps. Gets back to the issue of testing at the health service.
Yeah, basically, as you said, Preeti, from the time you take the test until you get the result back, you should isolate yourself as very best that you can, waiting for that test result and not knowing the answer yet. And the majority of our tests are still negative. Even amongst people with symptoms, the majority of our tests remain negative. But you have to make a presumption that you might have the disease. You isolate yourself as best you can, and then you get the test result back within a day. Yeah.
Yeah, thank you. And I just want to make one more comment. I think that the distress that comes with that positive result is not something trivial. And I think especially for our students living in the residence hall, I mean, this is, they're younger students. This is 17, 18, 19-year-olds. I think it is stressful. I think the first tendency is often to call home, which is okay. Parenting doesn't end, and parents have an important role in this, but also do look on the website. The information's there. Sometimes in that moment, it's hard to look and to look for that information. The RAs should have some information too, but again, I think in our virtual world, some of these normal connections might not be there. So that hotline and then the UHS team is also very helpful. One other question, and this again, I think this goes back to Provost Collins, is lots of questions around winter term. Can you discuss where the planning stands right now in each of your areas? And again, I think we could start, we can go around on this.
Sure. So why don't I jump in? As I said in my remarks at the beginning, we are doing quite a lot of work to gather input from our students, our faculty, instructors, and our staff, because there's a lot that we have to learn from the experiences that we have had and that we are having. So while there's a lot of work that's already been done, we have not made final decisions for what the winter term will be, and we'll announce those no later than November 1st. So there's also been a lot of work in the schools and colleges and focusing on what things, as I said, are not working as well as we would like them to, and how we can address them in a variety of different contexts. So I don't want to be more specific or explicit because, again, we'll make a final announcement before November 1st. But that will be across campus, and it really will reflect all of the input that we're gathering from our constituencies and all of the learning that we're doing about things that we can figure out better ways to do.
Does anyone want to add to that?
Yeah, I would echo Provost Collins' comments. I mean, we are planning for a similar semester, but there'll be a coordinated university decision based on information we receive that could change that plan. So we are being nimble and flexible and able to pivot to a different kind of plan if we need to.
I'll just add that what probably won't happen is that we'll all be vaccinated by January. You know, I think that that's something that back in the summer we weren't really sure about timeline. I think that there are some optimistic signs, but and I will say too that the health service as well as Michigan Medicine are gearing up for whenever the time does come that a vaccine becomes more widely available, that they'll be able to help distribute this. But you know, I think unfortunately, and this is with my infectious disease hat on, is that that we're going to have cases, and we're seeing surges throughout the Midwest right now, and I think the holidays may create some difficulties even on the healthcare infrastructure. So, you know, unknown, but you know, reasons for optimism, but reasons for concern. So one of the other concerns, and this is something that has come up before. What are the staff infection numbers that are directly tied to working on campus? And I can weigh in a bit, and I may ask Mark to weigh in as well on this. You know, back in the spring, there was clearly, it was a different situation, and there were some transmissions that likely happened on campus. And again, I think it was in the era before masks, before we understood fully what was happening with asymptomatic spread and the value of face coverings. I will say now that at least in the classroom, I'm not aware of infections. I mean, when you have high transmission occurring in the community, some people do become infected. And again, speaking from on the Michigan Medicine side, one of the concerns has been social gatherings that occur sometimes on site, but I am not aware of transmissions occurring on campus with staff. And Mark, I don't know if you're up on that.
Yeah, the last I inquired with our EHS and OHS folks was about a week ago. There's no documented transmission to faculty and staff on campus. However, there are a handful of cases, literally fewer than 10 cases amongst faculty and staff where there's no explanation. There's no cluster. There isn't a person they obviously got it from, but there's no explanation of where it came from. So I would never say never, but as of a week ago, we had no examples of documented transmission like we do in the dorms, where we have a cluster of students with a social interaction, or in the fraternities or roommates in town. We've had none of those instances of a documented transmission, although you can never say it's impossible. But you know, in effect, the masks and the keeping the distance works, and most of the documented transmission that we understand is happening, you know, socially outside of class and off the campus.
And if I recall, a few of those cases were on the research side, some of the staff ones, and again,
two in research, yeah.
Yeah. So there wasn't transmission even in pretty close quarters there. The next question is related again to COVID vaccination. Will it be mandatory for faculty and staff, like the current influenza vaccine for Michigan medicine faculty and staff? And you know, I can weigh in on this. I think it's unknown right now. I suspect at the health system, it will be strongly encouraged, if not mandatory, and that likely this will be where this will be one of the populations that gets initial access to vaccination. But you know, right now we really don't have enough information to comment on that. We've talked a lot, you know, Mark, we've talked a lot about vaccinations of students coming in. And, you know, again, this is a good opportunity for us to revisit that. I know Rob and I have had a lot of discussions with you on this. You've been following this. I don't know if you have any thoughts.
You know, all I'd say is, you know, if the data really is compelling and we get good recommendations from independent reviewers, we're going to do our very best to strongly as possible encourage people to be vaccinated and to get the supplies of vaccines we need to get people vaccinated as quickly as possible. We haven't yet discussed whether that involves coercion. I think that's the last thing you do. You know, the very first thing you do is you make absolutely sure the vaccine is safe. Then you make sure it's effective. And then you use, you know, all of our persuasive powers to explain to people how it's in everybody's interest in our community and will help get us back to normal as quickly as possible. But we haven't discussed making it mandatory.
And I will just add that the safety and efficacy are going to be essential for any kind of approval to occur. I know there's a lot of chatter around this, but I have confidence in the FDA and the CDC making good decisions on that. So I think we just have a few more minutes. If anyone has any final thoughts, we could go around quickly and probably wrap up. Maybe Provost Collins, I'll begin with you.
Sure. So I'm just, again, going to remind people that we are really looking for their input and to look out for the surveys that are coming forward. To remind people that these continue to be stressful times, and so the self-care is very important. As the semester continues, there's a lot going on. And so please continue to reach out, and we will go through any additional questions we didn't get to and make sure that we are able to provide responses in the days ahead. So thank you very much for all of those.
So, Dean Jones, any closing comments?
I was going to mention self-care. Instead, I will pivot and say, remember to take the survey.
Great. Vice President Harmon?
Yeah, I just want students to know that we care about you, we're listening to you, but we also need you to do the right thing through this next few challenging weeks. We really need you. Thank you.
Great messages. And I'll give the last word to President Schlissel.
And the last thing I want to say is a question that's come up that we didn't really get to, but it's really important. I share everyone's concerns about the K through 12 schools in Ann Arbor. I have reached out to the superintendent. We're going to sit down and talk about what the university can do to help the schools open up for students, you know, especially the youngest students, the K through 6 age students whose educational deficits are mounting, and we really feel a shared responsibility. She told me that she was actually misquoted when she said that the university being open was part of the reason the schools were closed. I was puzzled, but I'd like to understand from her if there are things the university can be doing that would help the school system open safely. But I share the belief that many in our community have, that for the sake of our children, but also their parents and their ability to work and to provide for their families and to do their jobs and to lower their stress, working together to get the K through 12 system up and running is a real university priority. It's not just an Ann Arbor priority. So I wanted to say that. And look, thank you very much. It's been a challenging week. There'll be another challenging week ahead at least. I continue to share Preethi's sense of optimism that if we come together as a community and do our very best at following the things that we know that work and we've proven that work, we can get ahead of the curve and be able to make it through the end of the semester. But I think realism is incredibly important, as is honesty and transparency. If it turns out that the data indicates we can't continue this safely, we'll find a safe way to wind down the semester early if we need to. And of course, we're not committed to any plan for the winter. We want to come up with the best plan, the right balance between education and safety. And we're going to take advantage of what we're learning this semester to inform next semester, along with those surveys that the provost and vice president have mentioned. So thank you all very much. Take care of yourselves, be safe, and we'll see you again at this venue next week. Thank you, and go Blue.